We sometimes get asked by practitioners, like, how long would it take me to learn all of these different epigenetic influences, right? From what our immune system, what causes the dysfunction to our immune system and autoimmune conditions, or immune deficiency, or endocrine disorders, or cardiovascular, or neurological. There's a lot of different systems, right, that we look into. Of course, we dive a lot in the first probably 2 or 3 months into some of the major epigenetics, right? Like the gut, the environment that we're exposed to, what we're eating, what does that do to us? We're looking at cellular function, mitochondrial energy production. So we look at a lot of different factors. But interestingly, a lot of people just sometimes ask us practitioners, like, how long would it take me to apply this? Like, I have patients that are sick right now, right? Some of them are not getting any better, right? Or some of them are keep coming back because they struggle. I don't have years to spend on learning all of this, while if there's something that I can do to help them now, um, that would be amazing, right? That would be beneficial for not just for them, because that's what we do it to help them to transform their lives and their family lives, but also for you as a practitioner to develop your skills and develop your practice if you want. I'd say probably last 6 or 7 years been working on different tools to quickly apply functional medicine in their practices. That's including impacting their methylations, or the detox processes, their endocrine neurological function. So I wanted to share with you the functional and integrative flow. And this is really after coaching hundreds of practitioners to do that. We now can summarize the whole process in simple 4 steps that anybody can do. Literally any healthcare practitioner, and I'm saying any healthcare practitioner can do it. And these are the 4 steps. So the first step is the review. This is where the patient comes to see you. You look at their story, you look at their medical history, you look at their lifestyle, occupation, major concerns, right? Now, the second step, we go into identifying, right? So identifying, what is it? What are the factors that are contributing or triggering to the dysfunction? What factors can impact our methylation, right? That's what we refer to as epigenetic. And so you don't need to have years of studying and seeing patients experience with functional medicine to apply this. We actually created this functional health evaluation tool that you give to your patient. The patient fills it up before they show up for the next time, and then, or they just upload it to the secure portal. And within pretty much 3 to 5 minutes, you can already look at the score and signs and symptoms of each one of those factors or categories. So if the patient comes to see you and they're like, here's the form that I filled up, and you look at it and you're like, oh, okay, so you got a lot of signs and symptoms of mitochondrial dysfunction, or environmental exposure, or certain nutritional deficiencies, or exposure to endocrine disruptors, or whatever it is, right? You can very quickly identify what are the top 2 things or 3 things that you can provide recommendations about and make the biggest difference for the patient that is in front of you. For several years, the practitioners in my practice have used it, the physicians, nurse practitioner, the nutritionist, and it was very, very successful because, one, it saved us a lot of time on trying to identify what it is and asking a million and one questions. Second, it almost like a funnel. It takes all of the patient's experience and exposures and risk factors and everything, and kind of funnels it down to like the essence of it. So you can go into the advanced and clinical functional medicine portal when you're in the program and just download it. You get a lifetime license to use this tool. So use it, because it is game changer. It's a game changer, right? Now that you have the top 2 or 3 things that you want to work on, let's move to step number 3, and that's creating a plan. Now, creating a plan used to take a long time, even for somebody who is experienced, right? I went through 3 different functional medicine programs. I went through multiple integrative and nutritional and herbal medicine program. And I remember myself sitting there, and after I would see a patient and I would know, okay, this is the 2 things I want to work on, or they also have diabetes and also have, joint pain that I want to help them with, and I would have multiple books that are open, herbology books and supplements, and I would have Dr. Gabby's nutritional medicine book, and I would have this, and I would sit there to build a protocol, and it was very tedious, very time consuming, and it's not really practical for most practitioners, especially when you're getting busier, right? So this is the reason why we developed the Quick Start Guide. Quick Start Guide essentially has very specific protocols for each one of the root causes. So the patient, you just found out the patient has high exposure to heavy metals. Okay, they have signs and symptoms. Maybe you can see it on the form that they're eating a lot of canned food or lots of seafood or whatever it is. They get the signs and symptoms. Okay, great. We can, the Quick Start Guide you want to use to see which functional labs you might consider for this lab to get more data. It also tells you what are the specific protocols, functional medicine protocols you can use, and which clinical studies there are. So it's all evidence-based. What is the dosage you want to look into, and which supplements it's found, right? Now, the patients also have other factors, other things they're concerned about. They have joint pain every day. Maybe they're feeling tired. Maybe they have headaches. Maybe they have whatever it is. We developed together with a technology company a phone app, functional medicine phone app, that has all the treatment protocols. For example, all you got to do is just type in headaches, and it pulls up all the treatment protocols. You type in type 2 diabetes, arthritis, joint pain, and it gives you the very specific protocols. So essentially, you can build a whole protocol in 5 minutes. Within just a few minutes, you get all the answers to what do I do with a patient, what type of supplements, what type of protocols, like everything is there for you, right? Now that you have the health plan, you provide the value for the patient that no other practice in your area can provide for them, right? And it's all evidence-based, right? And you're giving them exactly what's going, you educating them about what's going on and how to do that, right? And that's the last phase, which is providing evidence-based strategies to support healthier function and well-being. And that's how a lot of physicians in our community are doing it. That's how a lot of nurse practitioners and even nurses who are doing health education. So again, none of this is to replace primary care. We're not diagnosing diseases. We're not prescribing medication, right? This is purely focused on the functional and integrative approach of really focusing on identifying what's causing the dysfunction, removing it, and working towards healthier function, right? That's that concept of precision medicine. So what's really cool about this is that all of those tools are included now in our program, right? So when you look at the Advanced in Clinical Functional Nutrition Medicine Practitioner, which we have in our next picture, you can see that includes, we focus on the clinical application. In the first 3 to 4 months, we teach you pretty much all of these different major epigenetic factors, root causes, but we give you the evaluation tool and your clinical guide and the phone app from your first month in the program. So literally, we get you right into it, and we are here with you. So we have amazing mentors such as Dr. Esha, Dr. Chill, Dr. Kim, to help you utilize everything, right? So you can do case studies and see, you can use the evaluation tool on yourself. That's what I did. And I used it on a family member that needed help. I saw what needs to be improved, optimized, and then I worked on it. And it's kind of like encapsulating years and years and years of functional integrative medicine experience and knowledge and multiple books and protocols and studies from PubMed, all into like simple tools that can help you get started right away. And of course, it is self-paced, so we can help you around your schedule. And there's also live and on-demand workshops, classes like we're doing right now, but specific workshops on building your first functional medicine program for your community. So if you're interested in learning more about these tools, reach out to our team. We can help you get started. And of course, if you are already in our functional and advanced program, then make sure to get the evaluation tool and clinical guides and book your consultation, book your coaching, because we're going to show you how to use all of those tools. And if you don't have a practice yet, that's okay. That's perfectly fine. I started on myself, and then I came up with my mentor, and we did He showed me how to use all those tools. And then I found a family member that needed help. And then I had them fill up the evaluation tool. And I came in, and we have a HIPAA compliant portal. So everything is very discreet and secure. And so we want to help you apply this, not in 6 months, not in a year. There's people that need you right now, probably in your community, maybe in your family, maybe friends. Let's help them. Let's help them while you develop that functional medicine muscle.